My name is Vince Anger. I'm your host this morning. You notice I am still trying to get my act together this morning, but Pam Sutton is with me. She is the resident life director. But actually, I think, Pam, you are at least double-hatted, if I'm not mistaken. And Pam is going to give us an update on home health, I believe.
Yes, I am, and you're absolutely right. Wearing many hats nowadays. Yes. And today I am covering for Leanne Smiley, who is my clinical manager over home health.
I met Leanne Smiley once here. I interviewed her. So.
Yes.
All right.
She's actually enjoying a wonderful vacation, so I certainly told her she can do that, and I can cover all of the bases for her. So as I mentioned, I'm here this morning just to give everyone a brief update on home health or certified home health. And I know that perhaps some of the residents may confuse that department with our home support
I still do.
department.
I've been here over 5 years. I still do that.
Well, I tell you, it's one of the things that we've gone back and forth with discussions on should we change the name, because the names of both departments are so similar that people can become very confused. But one of the, or two of the biggest differences between the departments is that certified home health, which is what I'm talking about today, is our department that offers nursing services, physical therapy services, occupational therapy, and speech and language pathology. We do have some aid services, but the majority of our private duty aid services are covered by our home support department, and those are those wonderful men and women that you see that are wearing the blue shirts, which is a different department.
Sure.
One of the biggest differences as well is that with certified home health, those services are covered by Medicare.
Okay.
Whereas with home support, that is all private pay.
Okay, sure.
So those are the two biggest differences between the departments.
I still confuse that also. Yeah.
Well, the good part about it is when you think about our home health department, typically how those referrals come in or why you would need those services, that's when you might be returning from the hospital. Let's say you've had an illness that has left you weaker. Perhaps you might have difficulty either swallowing or difficulty walking or just getting from point A to point B. That's when you would receive our home health services that's covered under Medicare. What would happen is we have a wonderful ACC that goes to the hospitals and keeps tabs on our residents here at Green Spring and lets us know how they're doing. And then she'll let us know if someone's coming back with a referral from the physician in the hospital as to whether that resident may need additional services.
Sure.
Based on that, we actually will send out a team of people, either it's a physical therapist or a nurse, that will open the case. They'll take a look at the client, they will do a comprehensive assessment, and at that point, they will determine what services are needed. So for example, some of the services, let's say someone's having a difficult time getting in and out of bed on their own, or someone's having a difficult time dressing and bathing themselves, after an acute illness. Or they might have difficulty with speech and swallowing, or there might even be a change in their memory. That's when one of those departments would actually come in, or one of those professionals would come in and provide several weeks of treatment to get the resident back on their feet and to the point of living an active life as they were doing before their illness. One of the biggest differences, though, or qualifiers to be able to receive these services, is that you have to technically be homebound. And I know that's actually been a rather big point of discussion over the last several months in terms of what does that really mean? Does that mean I have to stay in my apartment, from, all the time and never be able to leave? Well, of course, that isn't the case. Keeping in mind that, Green Spring is, all-inclusive in terms of services provided, then of course we understand that that excludes being able to go to the dining room. Of course, you can go out and get meals, whether you need to go to the barber shop, whether there's doctor's appointments in our medical center. Those aren't things that would prohibit someone from being qualified as homebound.
Yes.
Now, if you are the type of person that enjoys playing cards and you're going out to concerts and things of that nature, then how Medicare looks at that is, well, that person isn't really homebound, and that's when the person will qualify for outpatient
Pumping
services.
iron, I suppose.
Exactly. If you're going to the fitness center and you're spending time taking those wonderful classes or swimming every day, then that really doesn't qualify you for homebound services. And as I mentioned, then that's when the referral would go directly to our outpatient services. There are also times when we are seeing clients that are coming from Garden Ridge. So let's say that there has been an acute illness, you're not able to return back to your apartment, you go to Garden Ridge to receive continued rehab services there. You're to the point where you no longer require the services at Garden Ridge, but you're still not quite on your feet and completely independent. Well, then again, that's when the team over in Garden Ridge will refer the case to Certified Home Health, and then we'll follow the same process as far as the assessments.
Yeah, sure. All right, good. How many do you have on the staff doing that?
How many staff? So right now we do have one speech and language pathologist that we will be sharing with our outpatient rehab department. We do have 2 occupational therapists, we do have 2 physical therapists, and we have one right now full-time nurse, but then we have several what we call PRN nurses. And basically as we have increasing cases, then we're able to call these nurses in and they're able to provide additional assistance for us.
Good, good. What do you do to stay busy? After all of this. Is that all there is to it?
Sure, that's all there is to it. That only takes up about 2 or 3 hours of the day, and the rest of the time we're just staying downstairs and having a ball. No, the staff is incredibly busy. When you look at the fact that we receive several cases, on average I would say that we treat approximately anywhere from 20 to 30 residents a month. So, and when you're looking at many of those residents receiving multiple services, for example, they might require nursing care for, let's say there's a wound dressing, they're requiring physical therapy support to be able to walk independently again, and they're requiring occupational therapy services to continue to work on their bathing and dressing. So when you look at the fact that one resident might actually be receiving 3 or 4 different services, and that of course doesn't exclude our aid support as well.
So, so the number again, what was the number again? 30? Maybe
Approximately
up to
20 to 30 clients a month right now.
Yeah. But that involves what? How many visits? Maybe 3 every week, or 2 or 3 every week?
It really depends on what we call their plan of care. So
Sure.
when the clinicians go into the home and they do their assessment, it's based on what level of support that person needs. So it can be anything from 1 visit a week to 3 or 4 perhaps visits a week. It may not necessarily even mean the same number of visits by each discipline.
Yeah.
So it could be speech once a week, but physical therapy 3 times a week, and nursing 5 days a week. So it just really depends on.
Yeah. I came out of the hospital in June. I was hospitalized in June. A couple of hospitals over a period of 2 weeks, and I think it was Stella. Stella came to visit me, and well, I was doing pretty well, but it was a feel-good thing for me. I was just glad that she was there.
Yes.
Yeah, it was good. All right, so we're down to we're down to about 5 minutes here, and I've run out of questions. So you keep going.
Well, I know that you had mentioned that that when Stella came to visit with you, that it was more of a feel-good thing, and that's also something that we tend to recommend. Even when people are coming home from Garden Ridge, working very closely with that inpatient rehab team there, many times we'll recommend allow us just to come out and at least do 1 visit. Because there's a big difference between being in Garden Ridge in a much more, I guess, controlled environment, if you will, and then coming back home where you have to navigate around your own apartment, around furniture, making sure that you're safe. So there are safety assessments that we also provide with Certified Home Health. And so many times what we might hear from some of the residents is, I don't need you, I don't want you here at this time. And really it's just a matter of making sure that you're safe. So a visit doesn't necessarily mean that you're going to be continuing with the therapy services or the nursing services week after week. It could simply be just that 1 visit, just to complete the assessment, make sure that everything is safe for you at home, and to determine, you're fine. You really don't need our services. But we like to just check in on you to make sure that everything is okay.
I like to have you do that. Yes, that's
well,
nice.
Spread the word, please.
Yeah. I would love to read Stella's assessment on safety because I have piles of paper all over my apartment. And I can't zero them out. I can't get them down to zero. But what I do is I move them every once in a while.
Okay.
See, I reshuffle. It's kind of like what they used to say about the Public Works Department in New York City. They would come out every once in a while and they'd move the potholes. Never fixed them, they just moved them. And that's what I do with my piles. Now where do your staff, where do they come from? What have they done to prepare themselves for this?
Oh, goodness. Years and years of education and training.
Yeah.
We do have some nurses that actually have their bachelor's degrees in nursing. For the therapist, for example, with a speech and language pathologist, they're at a master's level. In order to practice.
Sure.
It's the same thing with occupational therapy now. And depending on, with the physical therapist, depending on how many years of experience they've had, I would say about 3 or 4 years, no, it's probably been about 5 years ago now, all of the physical therapy programs were became doctorate programs.
Really? Yeah.
So depending on the number of years of experience, our therapists can range anywhere from bachelor's degrees to doctorate.
Sure. My wife was a nurse, and in the olden days, if you held a bachelor's degree, you nursed. But if you had an advanced degree, you wound up behind a desk somewhere. You were an administrator. We're down to 2 minutes here.
Okay.
Yeah, keep going. You're doing fine. keep talking to me.
And you do find some, that's an interesting point that you raised. Some of our nurses have been nurses that in the past held management positions and supervisory positions, but with most cases, they really missed the patient interaction and patient care. So I actually have several of our team that if you would talk with them years ago, they used to be in management and they wanted to leave it behind and just get back to the basics and what they really enjoy.
That was a challenge in my career. You see, I was an engineer, and the instinct is to push you into management. And I'd say, "Oh, I want to write equations. Don't get me mixed up in all that." We're down to a minute, Pam. I thank you for coming. This is interesting. Because however many times I've been through this, I still get home support and home health. I still get them confused.
Well, just think of it this way. If you see someone that's pulling one of those suitcases and wearing a lab jacket, more than likely that's home support. Home health, and that's under a Medicare program.
Sure.
If they're wearing a green shirt or a blue shirt, they're with home support. So that's probably the easiest way. You can tell them apart by their uniforms.
Yeah, well, there's some of them who are towing things behind them, and they're usually trotting. They're usually in a hurry.
They are in a hurry because I have to admit, we've got to make sure that we're on time for our appointments, so they've got very little time to get from point A to point B.
Sure.
So, but usually, I know that they may be passing in a blur, but usually on their bags, it's written what department they're from.
Well, see, I've come to know some of them, but I want to stop and chat them up, and they don't have time for that. They got to keep going.
You can walk and talk.
Yeah, but I can't walk that fast. I have to turn around. All right. So, Pam, thanks for coming so much.
Anytime.
And I think we're kind of out of time here.